I'm Jack Guillory, former wrestler, Army paratrooper, and exercise scientist, now a PA specializing in men's health and sexual medicine. I've had the honor of learning from some of the best. Now I'm here to take the lessons I learned to help you maintain your health, performance, and vitality. This is Strong and Hard. Today we're discussing a PSA on PSA. So what is PSA? What's a prostate? These are important questions. PSA stands for Prostate-Specific Antigen. It's a protein found in the blood and produced by the prostate. We can test the level of PSA with a simple blood test, and we use the PSA level to screen for prostate cancer. However, PSA can be elevated for multiple reasons. It can be elevated due to infection, due to inflammation, due to enlargement of the prostate, or cancer. So having an elevated PSA does not automatically mean you have prostate cancer. If we find that it's elevated, we may need to repeat the test, confirm it's elevated. We'll check for infection, and we can also do imaging studies such as an MRI. Lastly, we may need to do a biopsy to confirm the diagnosis of prostate cancer. So what's the prostate? Well, the prostate is a gland found in the male pelvis. Urine passes through this gland as it leaves the bladder and enters the urethra. As men age, the prostate gland tends to grow. If it becomes too large, it can start to obstruct the flow of urine. This prostate enlargement is known as BPH and can lead to symptoms such as a slow urinary flow. However, BPH has nothing to do with prostate cancer, so if you're experiencing those symptoms, you likely just need treatment for BPH. Semen also passes through the prostate through the ejaculatory ducts. Importantly, the prostate produces a fluid that protects sperm as it travels to the egg. So how do we prevent prostate cancer? Unfortunately, there's no magic tricks. Just like anything else, you just need to take care of yourself. Good nutrition, regular exercise, and good sleep go a long way. Most importantly, regular screening. The American Urological Association recommends beginning screening for men at average risk of prostate cancer at the age of 55, at least until the age of 70. For men at high risk of prostate cancer, such as Black men and men with a family history of prostate cancer, we should begin screening at the age of 40. After the age of 70, prostate cancer screening is considered optional. The reason is, based on average life expectancy, if you were to develop prostate cancer after the age of 70, it tends to be so slow growing that you're likely to die from some other cause before the prostate cancer ever causes an issue for you. However, if you're in extremely good health past the age of 70, and perhaps you have a family history of living well past average life expectancy, continuing prostate cancer screening is probably a good idea, as it might make sense to treat the cancer if you developed it after the age of 70. What's a normal PSA level? For men above the age of 55, your PSA should be below a 3.5. Below the age of 55, your PSA should be less than 2.5. However, if you have an elevated PSA and you've had negative biopsies in the past, as long as your PSA remains mostly stable, there's not much concern. We just need to monitor it closely. What about testosterone and prostate cancer? Well, we used to believe testosterone caused prostate cancer. We now know that's not true. In fact, low testosterone may be a risk factor for more aggressive prostate cancer. We also don't believe that testosterone replacement therapy causes prostate cancer. In fact, many men that have been successfully treated for prostate cancer can safely be on TRT, despite the growing evidence supporting the safety of testosterone therapy in men with a history of prostate cancer. The topic remains somewhat controversial. You should really discuss this with your urologist. There are several different treatment options for prostate cancer, including watchful waiting, surgery to remove the prostate, and radiation and chemotherapy. Choosing one of these options is a highly complex and individualized decision that should be discussed with your urologist. Unfortunately, treatments for prostate cancer can often cause sexual dysfunction. You should be treated for these side effects alongside the prostate cancer treatment. In summary, know your risk for prostate cancer, ensure you're getting appropriate screening, as treating prostate cancer in the early stages is generally very successful, and ensure you're getting comprehensive care that not only addresses the prostate cancer, but also addresses any sexual dysfunction that may result from your treatments. As always, stay strong and hard.